What are sick puppy symptoms you should watch for? In this Vet Minute, Revival's Director of Veterinary Services, Dr. Marty Greer, talks about signs your puppy is sick, along with possible causes, including puppy car sickness. So first, let's talk about signs your puppy is sick.
So the most common thing that we see people calling us about is going to be diarrhea. Lots of puppies get diarrhea. It's very common. It's usually not serious, but it's pretty disconcerting because it's messy. It's hard on the puppy. Puppies don't like to have diarrhea. People don't like their puppies to have diarrhea. So I think diarrhea is probably the most common thing that we see. Although diarrhea is common and it's concerning, it's not nearly as concerning as a puppy that's vomiting and not having any stool. Because to me, that's more likely to indicate a possible obstruction, foreign body, something much more serious going on than your garden variety loose stool in the puppy.
Okay, so as far as the age of puppies, like when you need to be concerned, like what age are we talking about right now?
Well, this is primarily the puppies that have already left their breeder or their rescue group that are moving into people's homes. Breeders have a whole different set of circumstances and a whole different way of managing their puppies, because it's usually a group of puppies that are sick in those situations, not one individual puppy that may have eaten something that they shouldn't have.
Okay. Now we know that many viruses, including parvovirus, bacteria, and even parasites such as Giardia, coccidia, they can all cause a puppy to get sick. So what other causes of common puppy sickness are there? And does the age of the puppy really make a difference as far as how soon you should take action?
Oh, yes. The younger the puppy, the less likely they are to have the resources to bounce back from an illness. So the younger the puppy, the more seriously we take it. Like I said, a little bit of diarrhea is reason for concern, but not necessarily reason to panic. Vomiting, no stool, running a fever. So taking a temperature rectally on a puppy, anything over 102.5 would be concerning. Normal on a puppy should be 101 to 102.5. So if they get above 103, we need to see them. If they develop respiratory signs, coughing, sneezing, runny eyes, runny nose, any of those things we also see as a reason for concern. And then, of course, there's limping, other causes of illness. Sometimes they're not really specifically ill, they're just lethargic and not eating. But even that, if they're not eating and not drinking, those are even reason for concern, especially if it goes on for more than a few hours.
Okay, now I know puppy motion sickness can cause a puppy to get sick. What if you suspect that is causing your puppy to feel sick? What do you recommend to help when a puppy gets car sick? And is there puppy motion sickness medication?
Yes, there actually is. So the best thing for puppy motion sickness is to get them used to riding in the car, short trips when they're very young. My puppies go in the car every single day from the time that they're born until the time that they leave my house. So my puppies don't have problems with motion sickness. And if you're working with a breeder that's able and willing to do that kind of social kind of care, that's going to make a huge difference. Other things you can do for motion sickness would be feed ginger snaps, like the human ginger snap cookies, an hour or two before you travel, not feeding anything else so the puppy travels with a relatively empty stomach other than the ginger snaps. Making sure that the puppy doesn't look outside the side window as you're driving, so cover the crate or cover the window, because it's that side movement of things going past that can really make the puppies feel disturbed and upset. And then the final thing would be to put the puppy on Cerenia, again, a prescription medication that we can prescribe for the puppy if indeed the ginger snaps, the practice in short trips, all those other things don't work. Anti-anxiety medications aren't really a solution. Ace-promazine is definitely not a solution. So don't reach for ACE, don't reach for the human products like Bonine or Meclizine. Make sure you're using a veterinary product. And Cerenia is a tremendous drug. It's a great product for our puppies. It makes your travel, especially if you're taking the puppy camping for the weekend or you're going someplace on a longer trip, it makes your travel so much more comfortable. So plan ahead. Get the puppy in the car a few times before you travel, just to make sure that you're not going to get halfway down the road and realize that you're in trouble at a time of the day that your veterinary clinic isn't able to accommodate a prescription for you.
What are some signs of puppy motion sickness? Like, is it kind of the same as humans? Like, do they vomit, or what are the symptoms there?
Yeah, the extreme case is vomiting, but we'll see a lot of puppies come to the practice that are very, very wet-mouthed. They've been drooling, they've been nauseous. So their lips are wet, their tongue is wet. We take a look at them and their whole front end is wet. And you're like, oh yeah, we had a little problem in the car. And a lot of times owners aren't even aware of it. Now, if they have more than one puppy, probably somebody has vomited. But if it's just one puppy, that early sign of drooling and salivation is your first clue that you need to pull over, go find some ginger snaps, slow down your trip, and plan for a different day to go traveling if you have time to go get some Serenia for the puppy before you leave the next time.
Okay, thanks so much, Dr. Greer.
Hi, if you're watching on YouTube, consider subscribing to the Revival Animal Health YouTube channel. If you have a pet health question, call our pet care pros at this number. And don't miss our other pet health videos.